Go.
Hello, my name is Tim Thomas. I got my doctorate in physical therapy and I work at Eastern Shore Physical Therapy. Today, I'm going to be showing you some exercises that you can do at your hip. So the first thing that we do in therapy is we check to see if your musculature is tight. If anything is tight, then we should be elongating those muscles, so we need to stretch. So how we test for tight muscles are a couple different tests. The one test is called an Eli's test. That's how we check to see if your rectus femoris is tight, which is one of your quad muscles that crosses both your hip and your knee. So in order to do this test, you have to lay on your stomach and you bring your leg up towards your buttocks. You should be able to actually push to the point where you touch your buttocks. If you can't touch your buttocks, so therefore if you can only get to, let's say right here, before you start to notice that tightness, then more than likely that muscle is tight and we need to elongate it. So in order to stretch that muscle, there's a couple of different ways. One way is just like this. So wrap maybe a belt, a bed sheet, a towel around your ankle and just pull it until you feel a light stretch. Light prolonged stretching is going to elongate the muscle better than a short ballistic all-out stretch. So we recommend 30 seconds, 3 times. If you can't hold the 30 seconds, you can start with 20 and then progress to 30. Another way of stretching this muscle is just laying on your back, letting your leg fall off your bed, and bringing the leg back until once again you feel a stretch. Once you feel that stretch, stop. You don't have to go as far as you possibly can. However, if you're not feeling a stretch, once again, wrap a towel around your foot and pull it until you do feel that stretch. The third way of stretching our rectus femoris is standing, bringing our leg up like this. However, if you are doing this, make sure you're safe. So therefore, hold on to a kitchen counter, bed frame, something sturdy that's not going to go anywhere. For this one, I don't want you to cheat by bringing your leg forward like this. You're not going to feel a stretch that way. You have to bring the leg back like so. Make sure you're standing with good posture as well. All right, so the next test is called a 90-90 test. That's going to test our hamstring and see if that's tight. So there's 2 joint muscles back here that cross both our hip and our knee, kind of like the rectus femoris. So to do a 90-90 test, what you're going to do is you're going to lay down on your back. You're going to bring your leg up to 90 degrees, and then you're going to straighten your leg out. As you can see, my hamstrings are pretty tight. My rectus femoris was not. But for this one, if you can't get to 25 degrees, which is right around there, then your hamstrings are tight. So therefore, if it looks like this, your hamstrings are tight. If it looks like this, which I'm cheating, I'm compensating, but then your hamstrings are probably okay, normal length. But if you can't get to that 25 degrees, so if it's somewhere from here or lower, you need to elongate your hamstrings. There's a lot of different ways of stretching the hamstrings. The one is like I just showed you, bringing your leg up like so. Once again, you can use a belt, a bed sheet, a towel in order to hold it here. Another way to stretch it is sitting in a chair. Let me move some of this stuff and I'll show you. This is one of my favorite ways. So you're sitting in a chair, just prop that foot up, and then you should feel it. If you don't, all you have to do is lean forward, and now I really feel it. So this is a good one. That's pretty easy to do if you're just sitting there watching TV. A third way is standing and just propping your leg up onto a table or a bed, and then once again you should feel it. If you don't, then all you have to do is slightly lean forward and you're going to really feel it stretching back here. All right, so that's the hamstrings and the quad, the rectus femoris. in order to check our iliopsoas, that's a hip flexor, it does this motion. To find out if that's tight, you do something called a Thomas test. What you're going to do is you're going to bring the one knee up to your chest, and then you're going to come back and lay down like so. If you bring the camera closer to here, you will see that my opposite leg is propped up some. It's up like so. What that means is that it's tight. What it should look like is it should be down on the table like so. If it's not down on the table, that means that your iliopsoas is tight and you need to elongate that muscle. So there's a couple ways of stretching that muscle. The one is just like I showed you. Basically just bring your opposite knee up and then let this one fall down. Let gravity do the stretch for you. If you're not feeling a stretch that way, you are able to apply a little bit of pressure down onto the opposite leg. And then another way of stretching that muscle is squatting down like so. If you lean forward, then you should feel the stretch on the leg that's behind you. If you want to get a pillow, you can actually place that down on the ground and then lean forward like so. Once again, I'm feeling a stretch right here. So those are the three different muscles that we test for in order to find out if our muscles are tight. If our muscles aren't tight, then maybe they're weak. And if they are weak, then we need to strengthen the musculature. In order to strengthen the musculature, there's a ton of different exercises. I'll go through some of them from a progression from the easiest to the hardest. We usually start with the easiest exercises and then progress from there. So the first thing that I'll do is talk about a few of the muscles that surround the hip joint. The one is our iliopsoas, that causes hip flexion. Another one is our glute medius. That causes hip abduction, which is out to our side. If that muscle gets weak, sometimes you see someone walking with what's called a Trendelenburg gait. They're walking with a limp. Then another muscle is our glute maximus. That's the buttocks muscle. If that muscle gets weak, then sometimes you see people walking with a little bit of a lean backwards. That's called a gluteus maximus gait. Another muscle is our hip adductors. We have an adductor longus and a brevis. They're located in through here. They cause hip adduction, which is coming across your body. Then we have the rectus femoris again, which crosses the hip and the knee, and then our hamstrings, which crosses the hip and the knee. So let's start with strengthening the iliopsoas. So the first is what's called an isometric. An isometric is a contraction of the muscle without actually moving the leg at all. So what that's going to look like is we are laying down. We can bring our one leg up until we get to around 90 degrees. And then you're resisting with your hands at the same time as you're contracting the muscle. So I'm trying to bring my leg up, but I'm not letting it because I'm pushing my arms down into my leg. So what we're doing is we're holding this for 6 seconds and then we're relaxing. And we start with around 15 reps of 6-second holds. You can also do that when sitting. So if you prefer to be sitting there watching TV, bring the leg up, try to resist it with your arms for 6 seconds and then relax 15 times. All right, so the next one is going to be a progression of that, which is going to be single kneaded chest, just range of motion. So what you're doing is you're laying in what's called the hook lying position, which is just laying on your back with your feet elevated, like so. And then you're going to bring your knee to your chest and bring it back down. So you're doing 2 sets of 10. That's a good starting point for this exercise. The next one is going to be standing marching. So if you're standing, hold on to something sturdy, kitchen counter, bed frame, and what you're doing is you're just bringing your legs up like so. 2 sets of 10. If this one gets too easy, then you can progress to maybe having your hands just hovering over top of it. This is a good exercise for a lot of different reasons. Yes, it's strengthening the iliopsoas on this side, the side that I'm bringing the leg up, but it's also strengthening the musculature of the opposite side that helps stabilize that hip joint. So it looks easy, but it's doing a lot. It's strengthening this muscle, and it's also strengthening all of the musculature that surrounds this side. So that's a good one. All right, and next, a progression of that is single leg raises. So you're laying down in this position, and you are bringing your leg up like so, and then back down. Up like so, and back down. For this one, you're trying to come up to around your opposite knee in order to strengthen the musculature here, the iliopsoas. If you are just coming up a little bit like so and holding it, that's more for stability at the core, which is also good, but for this video, we're focusing on just strengthening the iliopsoas. All right, so that's that muscle. Lastly, obviously, if that gets too easy, you can always progress to using an ankle weight if you have access to ankle weights. The next muscle that I'm going to talk about are the quads. So one of the quad muscles is our rectus femoris that crosses the hip. So therefore, we want to discuss how to strengthen that. The first one is a quad set. So that's another isometric exercise where you're contracting the muscle without actually moving it. So you're laying in your bed, you put a towel or a pillow underneath your knee so there's a little bit of bend. And then what you're doing is you're pushing down into the towel so that you're straightening your leg out, but you're leaving your foot on the table. So you're not propping it up like this, you're just pushing it down so that this muscle contracts. You should feel the contraction. And for this one, we're once again holding for 6 seconds, and you're doing it 15 times. Progression of a quad set is going to be a short arc quad. What that is you're sliding something larger now underneath your knee, and you're actually straightening it up like so, and you're bringing your toes back towards you. So that's going to look like this. 2 sets of 10 is a good starting point, and then progress to 3 sets of 10 as able. If that one gets too easy, then you can add an ankle weight. If it still gets too easy, then we progress it to what's called a long arc quad. A long arc quad is just sitting with good posture, bringing your leg up, bringing the toes back, and letting that back down. If that gets too easy, then we're adding an ankle weight. The farther from the axis of rotation, the harder it's going to be during any of these exercises. So the farther down, closer to the foot, the harder the exercise will be. All right, so the next muscle is going to be the hamstrings. The hamstrings are located back here. In order to start an exercise program for strengthening for the hamstrings, we would do the isometrics once again. So what I'm going to do is I'm going to strengthen this leg by pushing it back towards the table here, but I'm resisting it with my opposite leg. So once again, you're pushing, you're holding for 6 seconds. You should feel that contraction if you stick your hands back there, and then relax. 6 seconds, 15 times. A progression of that is going to be side lying hamstring curls. So this one's easier. What you're doing is your legs are straight like so, and then you're just bringing the leg to your buttocks the best you can. A progression of side-lying hamstring curls would then be laying on your stomach, doing hamstring curls like so. The reason this is a little bit harder is because it's against a little bit more gravity. So gravity is pushing down on our leg in this one more than the last one. Okay, so if that one gets too easy for you, then we move on to standing hamstring curls. Hold on to something sturdy, bringing our legs up like so. Progression of standing hamstring curls would obviously be throwing an ankle weight onto the ankle and bringing it up in the air. For all these exercises, 2 sets of 10 is a good starting point, and then progress to 3 sets of 10 as able. All right, so the next musculature is the gluteus medius. It's located right through here. That's the muscle that sometimes causes that Trendelenburg gait, or someone walking with what looks like a little bit of a limp. In order to start an exercise program to strengthen that muscle, once again, we're doing an isometric. Isometrics are usually the starting point. So if you have a belt at home, take that, and I want you to wrap it around you, kind of like so. And what you're going to do is you're going to try to open your legs up by pushing into that belt, holding for 6 seconds, and then relaxing and doing that 15 times. All right, so a progression of isometrics is going to be laying on your bed, sliding over to the edge of it, and then going out to the side. So your gluteus medius causes hip abduction, which is the motion that I'm doing right now. For this one, it's important to keep your toes pointed straight up and not letting it fall out to the side. If you let it fall out to the side like so, then we're not working at that muscle that we're trying to target. So that's with gravity eliminated, which is going to be easier than the next one here. So the next one is going to be side-lying clams. Side-lying clams are laying like so with our knees bent. And then what we're going to do is we're going to open our leg up like so and back down. So these are side-lying clams. Once this gets too easy, then you can take a TheraBand if you have access to a TheraBand. Wrap that around the legs, tie it tight, and open and close with the TheraBand around you. If that one gets too easy, then the next one that we do is standing hip abduction. So standing, grabbing onto something sturdy, and kicking our legs out to the side. Once again, make sure your toes are pointed straight forward and not out to the side. After that gets too easy, you can take a TheraBand, tie it around something sturdy, like so, and then wrap that around your leg, and you can do the hip abduction exercises with the TheraBand around. If the TheraBand gets too easy, then add an ankle weight and continue doing those standing exercises. Once the standing exercises gets too easy, you can actually progress to laying on your side with your legs straight and going straight up like so. So this is now against even more gravity than the standing one. So that's why this one is a little bit harder than the standing. So adding an ankle weight is a progression of this one. 2 sets of 10 for all of the above is a good starting point, and then progress to 3 sets of 10 as able. All of these strengthening exercises, you don't have to do them daily. Strengthening exercises can be done every other day to give the muscle fibers a little bit of time to heal in between sessions. The stretching exercises that I showed you at the beginning of this video, those are exercises that you can do every day. Once in the morning, again, before you go to bed is a good starting point for those. All right, so the last muscle that I want to talk about today is the adductor longus and brevis. These are muscles that are located on the inside of our leg, and in order to strengthen that muscle, we start with, once again, an isometric. You're taking a ball, a pillow, a towel roll, something that you can put in between your knees. And then you're trying to squeeze it together without any movement, so the legs shouldn't be moving, so that you're feeling a muscle contraction on the inside of your leg. Hold it for 6 seconds, 15 times. A progression of that exercise is going to be laying on your back, sliding to the edge of the table, and sliding the leg that you want to strengthen in, like so. And then just doing reps, 2 sets of 10, of bringing the leg as far in as you can. Once that gets too easy, then you can progress to doing that one standing. Hold on to something sturdy and coming across your body like so. 2 sets of 10. And then if that gets too easy, add the TheraBand, like we did with the one where you're kicking out to the side. And then if that gets too easy, then you can progress through an ankle weight. These are the ankle weights that we use here. They just strap right around our legs, and then you tie them together. All right, so ideally, coming to a physical therapist to evaluate you, determine what musculature is weak, what musculature is tight, is going to be the ideal situation. So if you have access to a physical therapist, it's best to get their opinion on manual muscle testing you and determining, okay, this muscle is a little bit weaker on this side compared to this side. So therefore, if you do have a chance to give us a call at Eastern Shore Physical Therapy, we're more than happy to help you out. Our number here is 410-641-2900. We'd be happy to set up a free consultation, discovery visit. It's a therapy session that we kind of screen you, or we can set up an initial evaluation for you to determine if physical therapy is medically necessary for you to do, or if you want to come in, get us to evaluate you and determine, okay, these muscles are weak, these muscles are tight, these are exercises that you benefit from home. Once again, we're more than happy to help. Just give us a call.